He has been here almost 20 years. He started out as a PCA, just came here for a job. After he had been here for a while and started to see the needs that our people have, he became more interested in, building a career here than just a job. And he's done that. He went to LPN, well, he went to RN school, became an LPN while he was in RN school, completed RN school. He already had a great rapport established with his coworkers and with the consumers. Now he is an RN on the unit and an inpatient nurse manager. He is interested in taking care of the patients. That's why I think he deserves the honor and the award of Employee of the Year. It transcends the inpatient unit because he establishes a lot of relationships back there that go on to the outpatient unit. And he's the guy that will take as much time as it takes to have a good outcome. And his interest in a good outcome is for the consumer primarily, but also for the staff.
It's a unique opportunity for sure. I don't know, I got to tell a lot of people, like, we provide a service a lot of people don't even understand, and we give people olive branches that have probably burnt bridges their whole life. We give them opportunity to right the ship. It's always good to see people get better. I feel like we go the extra mile to make sure they're well taken care of and set up for the best possible success after care.
Dr. Vitiello is amazing, or as he's fondly known by consumers and staff, Dr. V. He is such a team player. When we moved to our treatment team model a couple of years ago, he was the first to volunteer. He said, I love this. I love the idea of being on a multidisciplinary team with therapists and case managers and nurses and peer staff. And he has just embraced that so much. And we've seen the outcomes of having these teams. And Dr. V is an amazing member of his treatment team. And he believes in the model and he supports all the staff on that team. And I think our consumers are better for that. And he's just a great guy. He really is.
Richard is the jack of all trades kind of guy. His main job is medical records, but he kind of goes beyond the call of duty. And as far as being genuinely helpful to others, it's whether it's helping families at the front desk, whether it's helping consumers, whether it's helping make this building better for consumers, whether it's auditors coming, he will go help check showers, take out trash. He has this kind of chameleon and flexibility to integrate in the back of the house and the front of the house that makes it really unique and useful. And it's also allowed us to do new things with paperwork and charts by having his perspective of working multiple shifts as direct care, but also coming into an admin role.
The first thing you'll notice about Marlon is his welcoming spirit, and he carries joy with him throughout his day. He has a unique way of engaging with anyone that comes into the office and has a joyous spirit in that. He always has some kind of a fun outfit on or is encouraging the office to celebrate something, an event, to wear matching Thunder clothes on Thunder days.
Marlon is a one-of-a-kind individual that it is an honor to work with him. He will work with the patients so well, and it's not like he's working, it's like he's enjoying what he's doing. He blends in so well and is able to connect on such a higher level than most people.
He's able to address difficult situations very easily and competently. He has a wealth of experience. He is definitely a central pillar in our office, whether it be to create a fun environment or it to be to help a person that has come here for service. He has absolutely an important role in our office.
George, he's one of the maintenance crew, and anything you ask him to do, he is always willing to do it. Even though you don't ask him to do it, he's always doing something. Sometimes I'll go to the cafeteria maybe to get some hot water, and he's in the cafeteria helping the people that works in the cafeteria serve dinner or lunch or breakfast.
I think he goes above and beyond what's asked of him. He goes out of his way to accommodate people. Sometimes when people are asked to do something extra, they reluctantly do it. Josh just goes and does it.
Everybody's easy to work with. Being maintenance worker, you get to basically visit with everybody. You don't have a real set office, but you get to visit with everybody and interact with everybody and see a lot of people in the facility and get to help them out.
Well, I know that Tammy has been with NCBH for 20 years approximately. And during all of that time, she's been in either the Alva or the Fairview outpatient clinics. She used to be a part of the PSR. Tammy knows her patients well. She knows a lot about their lives. There's many of the patients that she provides services for that she has been their case manager for 10 or 15 years. So, she has gained this relationship with them where they really trust her.
When I think of Tammy Severin, I think of a truly genuine person. Down to earth, honest, sincere. She is someone you can trust. And I think it is because of those qualities she's able to be so successful in her work. I feel like clients can walk in and feel like they can tell her what has happened to them comfortably, or pick up the phone and call her when they need help. And I think that's critical in the work that we do.
She's just very intuitive and good at building that trust. And our patients can't open up to us if they don't trust us. And she has that skill set.
Fairview is one of our smaller satellites, so a lot of times she's it. She's not afraid to step up and do whatever's asked of her.
This is a crisis center. Everything's, we always kind of joke, everything's a crisis at the crisis center. Erin is one of those individuals that is always calm, that is always, she's one of those dependable people that you can always rely on, count on, and that's important in an ever-changing, constantly crisis kind of situation. She's methodical, she's dependable, she's detailed. You look down at her avatar, her admissions are so highly detailed that the medical record staff love her, the billing staff love her because she doesn't cause any of those problems. But at the same time, she's just as willing to go out there to do direct care and housekeeping. And at the same time, she's just as willing to step in on a psychiatric emergency and talk somebody down, or step in on, even if it gets to the extreme situation of a restraint. You may not notice what's wrong until she's gone. And when she's gone, something's wrong. And that's because of all those things she keeps going. She may not be one of those people exploding in front of you with, but it's this constant, always there, dependable backbone of what O-Crew does.
So Ashley is one of those employees that you get just every so often that just comes on board and is 100% present and friendly with staff and consumers, very hardworking, very roll up your sleeves, get it done, common sense. She's just been a fantastic addition here at OKIC, and I'm glad that we are appreciating her this year.
She interacts really well. She treats them like she would, like a human being. Obviously, like she should. She treats them in a very therapeutic way. She wants to provide them the best care as possible. She makes them laugh a lot of times, gets along real well with them.
She takes the time to figure out how to do things right and efficient and gets it right the first time. And so that's greatly appreciated in a fast-paced crisis atmosphere. We really appreciate her and the work that she does. And so congratulations, Ashley, and we see great things for you in the future.
We jokingly say he is Bull from Night Court. His presence in the facility and with his staff is absolutely amazing. He's shown some leadership ability and encouraged his staff to take a safer approach to consumer care, to intervene in a manner that is that shows more dignity and respect for our consumers.
Brad's always been very reliable, dependable, someone you can go to, very approachable, always has your back, trustworthy.
Brad gets along with consumers very well. The majority of them really like him, especially the ones that have been here for a while and know him. He's real friendly. He doesn't treat anyone any differently than he would patient, staff, whoever. They're all the same. You can talk to him, he'll joke with them some. He's a real good guy. He's a very likable guy. You'd be hard pressed to find anybody in here that doesn't like him, I'd imagine.
You know, whenever you see someone come in here, they're usually at their worst. You know, we see them come in during admission and we're there when they leave upon discharge. And, you know, there's a lot of people that thank us when they're leaving. You know, it's very nice to see.
Sue-Ann is one of our clinicians. However, she is also willing to help with any need with any department. And so she's willing to help with the RSAs, if they need to serve dinner, if somebody needs to work extra. She is a definite team player and is always willing to help her fellow clinicians in addition to other staff. Sue-Ann is very strengths-based, very hands-on, so she always starts out with something positive, so it's very helpful in establishing rapport. She's a very strong advocate for all of her clients and getting all of their needs met, which is another reason why she's our Facility Employee of the Year.
What I think is amazing about Audrey is that she is so very competent. She started here as a PCA. She works the floor perfectly. She knows our patients. She works very well with them. She's now come up to be the supervisor of our PCA and CRS staff. So her competence is wonderful. The other thing though is that she has an amazing work ethic. Audrey is here in rain, sleet or snow. She's here if she's not feeling well. She leads from the front. And she just cares about her staff.
It's nice to be recognized for your hard work. Definitely a different environment, but it's what I enjoy doing.
Consumers love Audrey. There's times when Miss Audrey is the only one that can kind of get people to settle down, to listen to her. She's firm but fair, and consumers really respect her for that. She has excellent boundaries, but she's not afraid of getting in there and doing what needs to be done with our folks, and they know it.
This year we have 2 Employees of the Year from Central Office. These 2 individuals have gone above and beyond, and they've worked together on an incredibly important project. This year's Employee of the Year for Central Office is Mark Reynolds. Mark is our Senior Director of Decision Support Services, and he's just an incredible backbone for our agency. Not only is he there every day to make sure and oversee our division so that data is available, that we're looking at outcomes, that any reports we need or our providers need, the legislature, policymakers, media requests, all of that Mark is there for. But this year, Mark has gone above and beyond. When our Attorney General filed the opioid lawsuit to reclaim the damages for the state of Oklahoma that opioids have wreaked in terms of lives and dollars, Mark Reynolds stepped up. Mark has been an integral part of this lawsuit. He has spent countless hours creating a damages estimate, providing data so that the attorneys understand the extent of the problem. I have been told over and over by all the lawyers involved in this lawsuit, they could not be where they are in this lawsuit without Mark Reynolds.
This is above and beyond Mark's everyday tireless work that he does preparing this agency, looking at all of our data systems to help us prepare for our legislative services, looking at our performance across the board.
Mark is the heart and soul of data for the Department of Mental Health and Substance Abuse Services. For myself personally and for our STARS division, he is instrumental in our being able to carry out our mission.
He's done all this in addition to his day-to-day duties, being a fantastic supervisor, being a member of our executive management team. Mark is just a critical part of our agency, and I'm proud to say that he's our Employee of the Year for Central Office. Jessica Hawkins is also our Central Office Employee of the Year. Jessica is a national leader in prevention. She has elevated the issue of prevention both in our state and within our department. But this year, Jessica has been called to the forefront multiple times on important policy issues. First, we are in the midst of an opioid lawsuit filed by our Attorney General. Jessica has spent hours, days, and weeks preparing for a deposition in the opioid lawsuit. She has compiled information across multiple state agencies, held countless interviews, and prepared herself to testify on behalf of the state of Oklahoma.
Jessica's incredible. What she does
on a daily basis in the department is really kind of amazing to watch. She's involved in everything. She's part of some of the most innovative programs that we have out there. She's a tireless worker. She's always thinking about the department, thinking ahead, thinking about what she can do to better, not just what we do as an agency, but better the lives of the people that we serve.
I would say one of the things that I love most about her is that she's so knowledgeable in her field, but she's also very inquisitive. And I think that's such a sign of a really amazing brain, that she knows so much about her field, but she still always wants to know more.
Jessica's been a leader in the opioid epidemic in terms of combating overdoses, preventing addiction, providing naloxone to law enforcement. In addition, while all that was happening, the voters in Oklahoma passed a very poorly written marijuana law, one that is going to allow opportunities for kids and adolescents to have access to a product that is incredibly dangerous for the young brain. Jessica has again been called to the forefront to bring together what other states are doing to combat this issue, to help policymakers and officials across our state understand what marijuana actually does to the brain. She's been integral to figuring out how our state is going to respond to this issue and try to prevent adolescent abuse and addiction across the spectrum. I cannot explain the number of times we have called on Jessica for incredibly important issues this year, and she has stepped up in addition to all the important work our prevention division is already doing around suicide prevention, underage drinking. She has been compelled to the forefront on multiple issues this year, and she has stepped up to the plate every time.